Your spine is made up of a bunch of bones that are stacked one on top of the other, and in general they should be straight up and down. Scoliosis is a condition where the back is growing curved instead of straight. Typically, the child is not born with a spine that is crooked. It begins to develop a curve as they grow later in life, sometimes in relatively young years or sometimes not until adolescence. It can be initially noticed by the parents or a pediatrician, more frequently school screenings, which we do because there's interventions we can do to try and prevent scoliosis from getting worse as long as we catch it early enough. Frequently, we just observe. There are lots of patients with very small curves who don't require anything big. I always encourage parents not to be afraid to come in for an evaluation. It doesn't mean anything big or bad needs to happen. But in curves that are progressing or getting worse, we have ways of trying to slow that down, primarily with something like a brace, which, if used early enough, may prevent a patient from needing surgery at all. Curves typically will stop progressing when a child stops growing, unless they get too big. And if the curve is very large and is progressing even when they are old enough to be done growing, then we know it will become a problem over time, and those are the ones we talk about correcting surgically. Surgery for scoliosis is meant to prevent it from getting worse and to get as much correction as possible. It is a big surgery, but it's one that we can do very safely. We have navigation systems and other modern techniques to make sure these surgeries are done as safely as possible. It is a big surgery, and if anyone knew about it a long time ago, the recovery was much harder than it is now. It certainly still is a big deal, but kids are typically only in the hospital about 3 or 4 days. We have physical therapy, work with them, and they get up and move in right away. They're not stuck in bed. We encourage them to move right off the bat. And they're typically out of school just a couple of weeks and back to most activities by a few months. There are elite Division I college athletes who've had these surgeries done.